Hello and welcome. Thanks for coming to the Cancer Education Series this evening. I'm Dick Deming. I'm Medical Director of MercyOne Cancer Center here in Des Moines, Iowa. I'm also founder of Above and Beyond Cancer. And this Cancer Education Series is a joint collaboration between Above and Beyond Cancer and MercyOne Cancer Center. And it is supported in part by the Iowa Cancer Consortium grant. So welcome. You're in for a treat. I'm in for a treat today because I get to have a conversation with one of my favorite people. This is Kimberly Price, and you're going to learn Kim's story. Kim grew up in Waterloo, went to high school in Waterloo, and then went to the University of Northern Iowa. And she majored in both science and languages, got a BA, and then went on to get a master's in English and Spanish. She taught for a while and then worked in the corporate world with Wells Fargo. And over the years, she's done many different things. She's an entrepreneur, and she has her own company, and it is about how to thrive and how to get over adversity. And Kim's had some adversity in her life. As you might imagine, Kim and I first met because of our cancer connection, me being a cancer doctor and Kim being a cancer survivor. She was first diagnosed with cancer in 2009. And Kim, let me have you just tell a little bit of your story. And we're interested in learning about you and obviously about your cancer. And then eventually in our conversation, we'll learn how your cancer journey transformed your life and how you're, making lemonade out of lemons.
Yeah, definitely. Yeah, it has been a journey, and I don't know that anybody is ever prepared to hear the words "you have cancer." Wasn't on my radar. We just had our fourth child, so we had 4 kids under the age of 6. And I tell the story. I took the call. A friend of mine actually called, and I took the call in our bathroom. And you just don't forget those words. I'm sorry, Kim, you have cancer. And, part of my story is just remembering, the tears and, the feeling of the world caving in. And, I felt like I was going to pass out, and sitting down on the edge of the bathtub and knowing that I was never going to be able to go back to the way life was.
So you're in your 30s, probably.
Yes. Yep.
And you're married and 4 little kids.
Yes. Just had started a business. And so a lot of things happening. My husband had just built a new office, and so we were getting ready to move over to there, and there were a lot of things going on.
So back to that day you have cancer. What were your symptoms, and what was the biopsy that led to a few days or a period of time later that you got the call?
It took about 9 months to diagnose me because I just had Asher, our 4th. And so a lot of the symptoms that I was having were related, night sweats, could be nursing, hormones, fatigue. I had 4 kids and a business. So things just didn't add up, and my blood work was all normal. So it was really hard and out of the ordinary for anyone to think that I had cancer. And so it took about 9 months to diagnose me. I was diagnosed at the Mayo Clinic. And when they did all of the tests, post that initial CT, where they actually found it, I was stage 4, follicular lymphoma. So it's a type of non-Hodgkin's.
So a bone marrow cancer, if you will. It's one of the liquid cancers. And as you mentioned, it was the symptoms were pretty vague. And as you described your lifestyle, if you weren't tired, somebody would have thought you were abnormal.
Right.
And then seeking out where you wanted to get treatment. So what words were just used to describe, follicular lymphoma?
Yeah. And before I answer that, one thing that I want to say, because I know when I tell my story, I have people say, well, gosh, how would I ever know that I have cancer? I knew. There was something in my gut in the very beginning that knew that something was different. So I would tell you that there was a gut, and it's why I kept pursuing, and I listened to that, and I kept pushing, even though people kept saying, well, I really don't think you have anything to worry about. So it was just my own persistence and listening to myself and pushing forward in that. So, and then in answer to ask me that question.
Yeah.
again.
So for those who aren't familiar with the different types
Oh.
of lymphoma, when they described you did a bone marrow biopsy,
Yeah.
and they said, well, I'm sorry to tell you, but you have cancer.
Yes.
And maybe the words they used to describe this type of cancer, and just a little bit about the journey you went before you settled on which doc was going to be the captain of your team.
Yeah. So I think it's really important in the journey to find someone that fits you. And so oftentimes we go to someone, and this can be in anything in life, and it doesn't feel right. And, the initial doctor that I had is a wonderful person, but I had this feeling there was somebody else out there. And so he told me that I had a treatable, not curable cancer, that I was stage 4.
Mm-hmm.
And
let me just repeat that slowly. Treatable, but not curable.
Correct.
So here you are, 30-some years old.
33, I believe.
Married and 4 little kids. And your cancer's treatable, but it's not curable.
Yes. And I had a friend in taking notes because I knew I wasn't going to be able to remember the conversation. And I had some things jotted down that I wanted to make sure that I asked. And I went into that first meeting and I told him that I did not want the statistics and that I wasn't a statistic. And I just wanted to know what my options were. And so he did stick to the options. Unfortunately, there were a lot. And as it was explained to me, I could go with the harshest treatment first, which would include losing my hair, possible heart damage, sick, miserable, or I could start and I could actually do nothing, because this particular kind of cancer, you can watch and wait. And I went home and we talked, and I told my husband that it was like putting a dartboard on the wall and throwing a dart and hoping that I was going to hit the right treatment. Because if you did one treatment and it didn't work, when you tried the second one, it was not going to be as effective. And so it was a really difficult decision. So I made the decision to do nothing in the beginning.
And what was it like doing active surveillance, which is more than doing nothing, but it's not treatment, but keeping an eye on things? Was that anxiety provoking? Did you every hour of every day think about your cancer?
Not in the way that I see some. To me, it was empowering. Like it was, I had this overwhelming, I have a really strong faith, and I felt, this peace of the Holy Spirit from the moment I was diagnosed. So to be honest with you, I really don't remember ever having fear. My biggest breakdown was, I had 2 breakdowns that I can remember. Now I probably had more, but one was over losing my hair and what that was going to be like. And that's a conversation that's interesting. And then second was the thought of my kids not having a mom. I'm not afraid of death, but I don't want my kids to have to go through, especially at that age, all the firsts and graduation and kids and all the things I want to see.
Right. And the cuddling they need at that age.
Yeah.
In some ways, I would imagine, since you went through 9 months of knowing something was wrong, finding out a name for why you felt the way you felt was in some ways probably a relief.
It was. Yes, absolutely.
It's easier to face something that has a name than this unknown. We need to figure it out.
Yeah.
How long did you go in active surveillance before you started treatment?
I was diagnosed in June of 2009, and I started treatment in January of 2010. And I started treatment when I did because my accounts were changing. Things were changing, and I needed to do that. But during that time, I spent a lot of time researching, and a lot of time I traveled. We went to different places. I met with different people. And I was really looking for, I didn't know the words at the time, but I was really looking for an integrative way to approach it. Now I can say, okay, this is what I would look for. At the time, it was an intuitive, I can't just do medicine. I have to support my body too.
Yeah. And don't just tell me which chemotherapy drugs we're going to do. Tell me how you're going to take care of me. need.
Yes.
So maybe define for those who might not know, what does it mean, an integrative approach?
Yeah. So it combines both, all of the things in medicine that help achieve, killing the cancer and doing, I guess that side of it with supporting my body along the journey, because we know that the radiation and drugs and that tears us other good things down in our body. And so I wanted to make sure that as I was killing the cancer, I was supporting what needed to survive in order to support me to continue to live.
Yeah. And that includes such things as nutrition
Yes.
and mindfulness
Yes.
and physical touch therapy.
Yeah.
Maybe
Yoga.
describe some of the integrative practices that you found to be helpful along with the chemotherapy.
Yeah. So nutrition was huge. And for me, a lot of these things were my way of having control of something I had no control of. So the more that I could add to my toolbox, the more I felt like, well, if this ends sooner than I'd like it to end, I'll never look back with regret that I wish I would have tried that or done, this or that. So I became a yoga instructor. All these things I did, I always go to that little bit further extreme because I want to understand how and why it's positively impacting me. So I became a yoga instructor. I took herbology classes. I became a functional nutritionist. I traveled all over. I did a 3-week program in Arizona where I did IV therapy, high dose vitamin C, UV ultra light, colon hydrotherapy. I became a colon hydrotherapist. I mean, I'm not kidding. My husband, God bless him, he's really been
You
supportive
must have
of
more degrees and certificates than
Yeah. But it was, then I knew it. If I experienced it, then I could say to somebody else, this is what my experience was. It wasn't me being here. It was me being here and actually being able to share what the experience that I had was.
And maybe just describe in a little more detail the length of treatment. Are you out of treatment now? Do you think you'll need to go back into treatment? When did you have your last anti-cancer treatment? And you look fabulous. And we've had a chance to interact many times since 2011, I think was when we first met. And it was 10 years ago.
I know. Time flies.
Yeah. So how long have you been off of anti-cancer treatment? So
I started in January of 2010 and I did what's called the CHOP protocol. It's 6 months. So where I ended up was Nebraska Med Center. I was actually on a flight home from LA seeing a doctor out there. And he was more an integrative specialist. And I pulled out the United magazine and there was Dr. Armitage's picture at the Nebraska Med Center. And I don't know, I just felt this is the guy. Mm-hmm. And the very first time that I called the clinic, first I went back to the Mayo Clinic and I said, I think I'm going to change doctors. And I told my doctor and I told him the reasons. And I said, what do you think of him? And he goes, oh, he's amazing. I would absolutely, if you were going to make a change, he would be one of the people I would tell you to go see. And what I had learned about him was he's a world-renowned lymphoma specialist. And so when I called the office, they said, well, let me see what's available. We have several doctors here. And I asked for him. And so they set up a time. And one of the very first conversations I had with him was pivotal for me in the decision that I made. Because of the dartboard experience, I was really skeptical of, and I always am a bit until I learn more, but I was very skeptical of what to do. And I just said, he told me a lot about his family, his 4 kids, similar age as I was, his wife, incredible lady. And I just said to him, if I was one of your kids, what would you do? And he very quickly looked me in the eye and he said, Kim, I would go as harsh as you can and then work on the backside to repair your body. It's the best shot you have at a cure. And he never told me, unlike Mayo Clinic, he never told me that what I had was not curable. He always used the word cure. And so I listened, I did it. And once I made the decision, I knew I was never going to look back, no matter what. And I think that's important.
Mm-hmm.
You know, when you have a decision like that, you got to go with it,
Mm-hmm.
because hindsight's always 20/20.
And was Dr. Armitage and the folks at the University of Nebraska, did they provide integrative medicine options, or was that something you pretty much had to seek on your own outside the four walls of the University of Nebraska?
At that time, I would tell you no. Now things have changed a lot.
Right. But at that time, you were pretty much seeking the
Yes.
integrative part outside.
Yes.
And but sharing with him, you were doing that, I would imagine.
Yes, always. And he was always very supportive and would do anything that I asked. You know, I ask for things that I don't know that most patients ask for.
You're not bashful.
No, I'm not.
Your life is on the line. And
yeah. So I ask for what I want. And if, you know, one of the things that I asked for, I went back to the Mayo Clinic a few years back. So your question was, when did I end treatment? So I did 6 months of this rituximab and then the chemos, and that lost my hair, which wasn't as bad as I thought it would be. It was actually quite freeing because I didn't have to hide behind anything.
Okay, tell me the hair loss story, because I know there was something you wanted to say about it. The fear of losing your hair was worse than actually losing your hair.
Yeah, I mean, I was in my 30s. I was at that place in my life that I think a lot of women get to, that even in what might look like a whole lot of security, there's a whole lot of insecurity. And, you know, we hide that in all the things we do and all our roles. And I was afraid to lose my hair. I just was afraid that was somehow it was my identity. It was who I was. And I just remember, you know, going, and we went as a family, and we actually had an event, because everything has to be an event. And there were a lot of people there, and shaved my head.
Did everyone in the family lose their hair that night?
They did not.
No, they did not.
No,
okay.
They did not do that.
Okay.
Alexa was 7, and she's the only child that we took. And it was hard for her. That was really hard. We tried to make it fun. I had wigs. I hated the wigs. I actually preferred not to have anything because I felt so free without hair. So, and yeah, I went home. So we loaded up in the car after, and we went home, and I took my wig off before I went inside, and Asher was a baby. He was just, at that time, he was then 1 year old. And he looked at me because he loved my hair, and he was always playing in my hair. And he looked at me, and he couldn't quite figure out who I was. So that was hard too. And then he, you know, was fine shortly after. But yeah.
So you and I first met sometime in 2011, because you had applied and been accepted to do the Above and Beyond Cancer Journey to Kilimanjaro in January of 2012. And we were in this very same room. The gear was spread out, and we were getting ready. We were packing the gear. We were departing Des Moines on an airplane on January 1st, 2012. And it must have been like December 30th or 31st. We were in this room getting our bags packed. What do you remember about that day?
Oh, super excited. I mean, we'd all trained together. You'd built relationships with other people. It was going to be a once in a lifetime experience.
But you had a little bit of a cough.
I did have a cough, and I think I was going to hide that. I'd had chronic pneumonia from the drugs, and I had just finished my last. So rituximab went it was supposed to go 3 years beyond that end of treatment in May of 2010. So I was supposed to stop in 2013. But at the end of 11, I was so sick all the time with pneumonia and other things that Dr. Armitage just said, let's stop. We've reached the amount of time we need to statistically to be good, so let's just not do this anymore.
So I'm thinking it's like 1 or 2 days before we're going to get on the plane and fly to Africa. And we're in this room, and you have a bit of a cough. And I think your ribs were hurting, and maybe and we decided, before we get on the plane, it might be a good idea to get some imaging and see what's going on.
And I remember meeting you at Mercy, And you asked me a question. And I said, well, I've been on medication. I had self-medicated. I'd been on an antibiotic for 4 days. And I said, well, I've been taking an antibiotic for 4 days. I'll be fine in a couple of days. And you said, well, if we're going to go to 19,000 feet, you are not going to be okay. So we're going to do the CT and then I'll make the decision.
And so we got a CAT scan and it showed pneumonia.
Yes. Yeah.
And so we are having a conversation about we're supposed to fly to Africa and climb to 19,000 feet, and you have a bacterial pneumonia that is starting. This does not seem like a good idea.
No.
And so we had a conversation about that and mutually decided tearfully that this was not the right thing to do. And there would be other times to go to Africa, but that this could be putting your life in danger. I mean, regardless of your cancer history.
Yeah.
So that was a disappointing day.
Yeah, it was heart-wrenching.
Yeah.
Yeah, it was hard. It was really probably one of the very first times that I felt limited by my diagnosis.
Mm-hmm. Well, we're talking about that. Maybe talk about some of the low points in your cancer journey. And I want to talk about those because, I mean, you're an uber super woman, but even uber super women have low points. And so get real with the low points, but then we'll transition to how does your journey as a whole, how has it changed you? But maybe just describe some of the low points.
Yeah. I think the hardest things was trying to keep up with the life that I had envisioned having while going through chemo, raising 4 kids. I had to let go of my business, I am just in the last couple of years recovering from that because that was a lifelong dream that I had to build that. And that's been an interesting journey moving forward, but that was hard. The thought of letting that go and letting things go that I thought were going to be that weren't going to be. And I just recently had somebody tell me, they said in a real vulnerable moment, explaining some of the feeling behind even where I'm at today. And they just said, you're 70% of the way there, Kim. You're almost there. You're ready to tip the scale and where things are at. And that being that I am still at a point, and now I get it. Now I'm aware of it. So now I got to break it. I haven't been aware of it up until recently, but that I allowed what I thought I was going to be to play a role all of these years in who I haven't become. Because who I was is never who I'm going to be now, because cancer changed that. And so I'm still hanging on to this idea of what I think it should be instead of looking at the way cancer has transformed me and who I can become.
Yeah, and I would even add a different add to that perspective, regardless of whether you have cancer or not. We don't know what the future is going to hold, and what we think of is just like you mentioned 70% there. What do we even think of as being 100% there is probably not what we want a few years from now.
Right.
And that there's always this journey. I mean, what a boring journey it would be to just have this straight line to perfection. I mean, that's not possible.
Doesn't exist,
and there's ups and downs and twists and turns, and what we think is going to be the ideal life at some point ends up being, well, that would be so boring to live this life of just sitting on a beach and going to movies and doing stuff like that. And not that that was ever your goal. So some difficulties along the way, some low points. How would you now put into perspective the journey you've had so far that included your journey with cancer?
Well, one of the things that happened in the bathroom that day is that I stood up. I could hear my kids outside the door, and it brought me back to reality. And I looked in the mirror and I knew that I had a choice to make. And so before I walked out that door, my choice was that whether I lived 5 minutes or 50 years, I was going to rock the rest of my life. And so that's what I've done. And not that that's not been without this, right? I mean, I've had a lot of really, really low moments.
Yeah, but you're not dead yet.
Right.
You're not yet dead. The Spam-A-Lot song.
And I have a friend, Les Brown, says, you don't want to die. You want to die empty. You don't want to die full of something that you were supposed to give the world. And so I really want to empty out before I go. I don't want to have anything left. I want to give everything I've got.
Leave it on the floor.
Yeah.
You know, and I don't know if we specifically talked about this. I've talked about it before, but the Stoic concept of memento mori, remember you will die, not as this pessimistic, oh my God, I'm going to die. Let's wrap ourselves in black crepe and just stay in bed and let it pass. But no, we're all going to die someday. But guess what? You're not dead.
Yes.
You have today.
Yes.
So rather than it being a pessimistic worldview, it's this clarion call to do something with today.
Yes.
Because we all only have so many.
Yes.
Or as you say, just play it all out. Leave it on the floor. Don't take any with you.
Yeah. And I think the important thing is that, you know, we all have a gift. You know, we're all given this gift at birth, and nobody else is ever going to have your gift. You're the only one with that. And so I think it's important that instead of seeking out, you know, and this is hard too, not just a female, but comparing myself to what others, you know, are doing or have been able to experience, and not doing that. I have what I have, and I'm here to use what I have in the way that I'm supposed to impact this world. And getting caught up in the comparison is sucking my time that I could be impacting other people. So it's this constant bring myself back to this.
In this moment, right here, today, we have everything we need this moment.
Yes.
It's when we start regretting yesterday and worrying about tomorrow, we lose the beauty and the perfection of this moment.
Yes.
How has your cancer journey changed your kids, do you think?
Oh, I think significantly, because I changed. I mean, looking back now, I could see how I could have gotten caught up in the rat race of life, trying to achieve things and make an impact outside of my home more than really being in the home, making an impact. And my greatest legacy are my children. And, you know, what I teach and have taught them, you know, and I mean, I have a lot of faults. Trust me, if you sit here with them, they'll tell you.
We'll have to interview them to find out.
Right. But, you know, I think that I've taught them perseverance. I've showed them courage and strength, kindness, compassion, and they all have that. And I see that in them. And, you know, who they become is more important to me than, you know, what I can do outside of, you know, my own home. So.
To the extent you want to share anything about your relationship with Nate, how that has changed or transformed in any way because of your journey or the joint journey you all made with your kids, and any different perspective that has come from your cancer journey and the way it's affected your relationship? Yeah,
I think, you know, I look back and definitely over time and a lot of ups and downs, it's strengthened us. It's taken time. We both have the gift of persevering and fighting through things that are difficult. He was a great support along the way in the ways he knew how at the time, which we all grow. You know, what I wasn't good at was sharing anything. I was blogging, but outside of reading my blog, I really didn't talk about it a lot. And if I did, it was always in relation to how I could help you. I didn't want to go into the space of what was really going on. And I realized later that was because if I went there, it became real. And I didn't ever want it to become so real that I couldn't get out again. And so if I superficially kept myself at a distance from what was happening, I could conquer it. I could withstand it. I was afraid of crumbling. So I played strong. And I think that in some ways, you know, we'll all pull the positive from that, but in some ways that was hard on him too.
Yeah. There's got to be give and take.
Yeah.
You can't, He wants to be strong, and plus you're vulnerable. He can't display
I know.
his strength.
I know.
So he's in healthcare. He's a chiropractor.
Yeah.
Do you think witnessing and living with you as you're going through your cancer journey, do you think that's changed the way in which he practices his medicine?
Sure. Yes. And I think he, and this is just an opinion, right?
Mm-hmm.
His patients always, they have wonderful things to say, and he's very good at what he does. He's very good with people. But what he's most good at is how he makes people feel in a really short period of time. He makes them feel seen and heard and taken care of. And I think that he was able to, in the places where maybe we weren't able to connect, or I wasn't able to be vulnerable, he could take that in, and he was having a lot of conversations with patients about what we were going through, but the experience of cancer. And I think asking a lot of questions of patients while they were there to gain insight into what I was going through.
Even as you described it, your due diligence as you met with several different cancer doctors before deciding who was going to be the captain of your team. There's the saying, we don't care what someone thinks till we know what, we don't care what someone thinks till we know that they care.
Right.
And that idea of really caring about you, not just spouting statistics and proving that they're the smartest person in the room and know which drugs and doses by heart to give you for your disease. That's not what you want.
Right.
You want someone who, first of all, cares about you and will treat you like, if I was your favorite child, what would you do?
Yeah.
And they really care about you.
Yeah. And I think if I had to say one of the greatest gifts that he gave me was being supportive of the things that I did.
Mm-hmm. Yeah, like being willing to let you go to Africa for 2 weeks while he stays home with
4 kids.
Right. And a chiropractic practice. Yes.
Yeah. I mean, he's financially has supported and just been there in a lot of ways that I know it was hard on him too. And that's not easy as a cancer, the person that's had it, to take the time to sit back and think about what the other person has gone
so
through.
maybe we should interview Nate. Because, as I've never been the spouse of a cancer patient, but, there comes a time like, when do I get my spotlight, and how can I possibly say anything because I'm not going through this, but boy, it's difficult to be second fiddle forever.
Yeah, I know.
We can talk more about that, but one place I want to transition to is how the wisdom that you have gained in your journey, you are using not just to illuminate your own pathway, but you're using that wisdom in the business that you've created to help others who are facing adversity to understand that, adversity can be this bump in your road, can be a springboard, not just a barrier.
Yeah.
So at what point did you realize that you had learned some life lessons through your journey that were something that could be of benefit to others?
Mm-hmm. I think right away, just because of who I am, struggle creates opportunity. And I tell the kids, there's 3 things in this life that you can always count on. God loves you, we love you, and your perspective determines how you'll live the rest of your life. And their perspective, regardless of how bad things get, is all they've got. And the choice in how they choose to view life because of situations will determine if they live or they just exist. And I think that's important, and it's always been important to me, even if I didn't say it just like that, years ago. I knew how I chose to be inside myself every day was going to determine how life ended. And so one of the projects that, I worked on a few years ago for a bit, which was so rewarding, was interviewing, some of people I was very close to in the Amazing Women group, and a couple outside of that were terminally ill and in their last days of life. And really getting deep into very vulnerable conversations, asking questions about, what their impact has been, and what is it that they want to leave, and what is their legacy, and how can we thrive even in those last moments? Because I believe it's possible, and I also believe that it's necessary. If we have life is a gift. Sitting here, breathing, whether it's the life I want, no matter how uncomfortable I am or I get, it's a gift. And our responsibility is to use that gift.
Yeah. The Dalai Lama has once said that, the path to joy goes right through sorrow and suffering. And it's not like, okay, those people are joyful, just happen to avoid all of the difficulties. That a true joy, as in, a deep-seated understanding of meaning of life, is enhanced by some difficulties and travails and suffering along the way. The emotional intensity of life is so much bigger when you have valleys to compare to mountains, and you've got some pain to compare to pleasure, and that all of those are part and parcel of a life of joy.
Yes, agree. My word this year is abundance. 2020, ironically, was surrender. With all of the COVID and things happening, it was surrender, and I chose abundance this year. And every year I learn something. I choose the word, and I'm not exactly like, it's a choice coming from here. I'm not thinking this is a word that I want. It always comes from here, but I don't understand it until I get about halfway through the year, and then I see rapid growth through the end of the year. So abundance for me is really being appreciative and grateful in exactly where I'm at in the present. So it's not wishing that I was somewhere in the past, and it's also not hoping that I'm somewhere in the future. It's being appreciative and grateful for being here right now.
And as you already mentioned, it's a matter of perspectives.
Yes.
You and I could have exactly the same thing, and I might be looking at life as scarcity. What am I lacking? And the opposite perspective is, oh my gosh, look at this abundance of what I have.
Yes.
And it transforms you into what I don't have that somebody else has, to, oh my gosh, look at what I have been given, and how grateful am I for this.
Yes. And there was a quote, and I'm not going to remember. I'm terrible at remembering quotes, but it's something along the lines of, when you have gratitude, you experience true joy. But without gratitude, we never experience, the joyfulness.
Yeah. So I think one of the quotes might be the Brother Stendhal Rost. He's a
Jesuit
Catholic
priest.
And I don't think he's Jesuit, but he does have a saying that we're not grateful because we're happy. We are happy because we're grateful.
Yeah,
so
like
same
that.
sort
Yes.
of thing, that
Yes.
it's actually this appreciation for what we have that brings us the joy. It's not the stuff.
Right.
Yeah.
Yeah.
Well, why don't we see if we've got any questions from our studio audience here, or from the chat boxes. Do we have any questions that are coming through in chat, or from our live studio audience? Any questions? Looking over here, I know we have a couple that have gone through a journey with one of them having cancer and one being supportive. Any questions or comments about how a couple goes through the cancer journey together?
I'm glad you brought up the point of your husband and you going together in this journey together. It not only affects you, but affects your husband too. So I think we've been through that as well. Maybe not as harshly as you, but I myself, I can really feel what you went through from the other side, what your husband went through too.
Yes.
So I'm grateful that you brought that up as a presentation point.
Yeah.
As for you sharing what you had tonight, I mean, that's really, really cool. Lack of a better of us really need what you did in relation to what you had in front of you, what you have now, and what you're going to be doing in the future.
Yeah.
So I guess one of my questions is what is your aspiration for the future? What really drives you into that future now?
So, question in case it didn't come through the microphone is, what's your aspiration for the future? Right now, as you sit here in 2021 with a year of abundance, the perspective of abundance, where do you see your own personal growth? Where would you like to take it?
Yeah. So I'd separate that into kind of areas of my life because I have, in each of the areas, and I, definitely have financial things I'd like to do. From marriage, I continue, growth in our marriage and being able to continue to be more vulnerable and, communicate those things so that, when life, because this isn't going to be the last thing in life. And so being able to communicate, continuing to do things with the kids, and then in business, and I'd say my personal life, I've known since I was a little girl that I was put on this earth to make some kind of a big impact. Now, what that is, I love writing. I love speaking. I see a big event at some point. I go back and forth between that being for all versus, being just for cancer. I work in a lot of different areas, but I see this connection piece is so important. And survivorship is such a big part of the journey. And it's a part where we really have a gap in survivorship. And so how do we bring, more survivors together, and how do we teach them these foundational things to living out of their mindset and getting into the space that no matter what's going on in your life, you have this opportunity to use your gifts to impact somebody else in some other way.
Mm-hmm. Yeah. And obviously we share a lot of that perspective. We like to call it optimal living. I mean, optimal is the best it can be. And for some person, that might be running a 2:30 marathon. And for another person, it might be spending an hour walking around the track one lap. And, each may experience optimal living depending on where you're at. But there's always the ability to reach above and beyond what you think you can do. And how does going through adversity allow us maybe that perspective? But I'm interested in, one of my thoughts is, so for example, adversity, let's say cancer. Cancer doesn't necessarily give you strength, but it allows you to find the strength that's already deep within yourself. And when you get over a barrier, with support, you realize I can get over the next barrier. And recognizing the strength that we have within ourselves is really what we call resilience. Once you've found that within yourself, you sometimes then intentionally put a mountain in your pathway.
Yes. Yeah. And I do think it's like a muscle. In order to make it stronger, you've got to work at it. And it isn't something you just necessarily have overnight. And so that connection and that support, like Above and Beyond Cancer does, and having the community around you to support you, you can continue to build that muscle. And when you have that dip in your life, the community's there to say, okay, we understand you're here, but now it's time to get back up and take that next step.
You need the support. Sometimes the support is a hug. Sometimes it's a kick in the butt. But if you're facing adversity without support and you don't get over it the first time, that's what leads to post-traumatic stress. But when you face a challenge and with support are able to get up and over, that's what leads to resilience. Where do you draw some of your insight, wisdom, strength? And I'm thinking of things like, turning to your religion, turning to poetry, turning to art, turning to music, turning to, physical exercise. Those are just a few where, we all go through some ups and downs and some highs and lows and some times of blue and times of incredible joy. Where do you turn when you're trying to inspire yourself?
Well, I have very few days that I get up and I don't just want to get out of bed and get moving and have 1,000 things I want to try to create in my world. I'm a creator. But when I have those moments, I don't feel that way. It's really hard for me. My faith is number one, for sure. That's a place that I, draw a tremendous amount of strength from, insight, and out in nature. I go out and, do stuff early in the morning. I have a yoga practice. I do meditate. In all of those spaces, I can really feel the movement of the spirit in me. And a lot of my creativity comes from that. And so without that, that's something nobody can take from me because it's in me. Outside of that, I would say that now I have an awareness when I'm in a funk that there's a certain number of things I need to do to get myself out of that. And I also know that the next day is a new day. And so if I can just get through this day and do the things that I know I need to do in this day, when I wake up tomorrow, it'll look different. So.
And are there particular creative activities? You mentioned writing.
Yes, I love writing. I really enjoy music. Art, yes, but it's really creating for me is all of it. So I have a podcast. It's called Aging Like a Badass. And I love interviewing people. I love having conversations because I'm curious. How do you do it?
Mm-hmm.
What does your life look like? And how have you risen above? We all have things we're going through. It's, bankruptcy, divorce, traumas, dramas, all kinds of things that are happening. And so what are you doing that maybe I'm not doing? And how can you inspire somebody in a way that I can't inspire?
Mm-hmm.
So my podcast is a big one.
How do you choose who you're going to interview or have a conversation with on your podcast?
Most people, there's a personality test called the Enneagram, and I'm a 7. And a 7 is an enthusiast. So I create and create and create. I'm not necessarily organized in my execution of things. So to be honest, every week I kind of let it just come to me, and it works. So everything's organic. You've been on a summit that I did. And,
right.
We had great conversation, but I didn't plan for that. There were no questions ahead and I just feel like that being vulnerable, being organic, opens up more of being you and being real.
And I totally agree. So we've been doing this for, 13 years or so. And, it started off as more of a lecture format.
Yeah.
And with COVID, we've converted from, come to the lecture to come to our video podcast conversation.
Yeah.
And ends up being a conversation rather than a lecture that allows us to, really delve into what makes us tick, what we've learned on our journey that might help others on their journey. Speaking of which, can you think of an example of someone who preceded you in their cancer journey who shared wisdom with you?
Well, I'm going to be honest. I can make something up. So I only knew, prior to my own diagnosis, I had only known 2 people in my entire life that had cancer.
Yeah.
One was a boy from high school that was a couple years younger, and the other was a family friend that was about 5 years older, and we never talked about her diagnosis.
So I suspect that it was people who kind of went through it parallel to you that you've come to know through your shared diagnosis that you share wisdom with.
Yes.
But it wasn't necessarily that someone was giving you some wisdom as you were starting your journey. It's
Correct.
more that you've surrounded yourself with like-minded folks that have gained wisdom on their journey, and you keep reinforcing each other's.
Yes. I would say, if someone out there was like me, because I'll just be honest in how I felt in the beginning, lots of people came forward and wanted to give me names and numbers. And I think Leukemia Lymphoma Society had somebody call me, and what I was finding, so I have a treatable, not a curable cancer that typically only men in their 60s and older have. So being 33, female, with, you know, young adult cancer survivor, it was, you don't find many of me that can, you know, have a conversation with me. So a couple that were maybe similar cancer, or I think there may be only one or two, but they were in their 60s, females, but in their 60s, I didn't feel like I could relate. Now there's two things here. First of all, I was a young adult cancer survivor. So we know that the research shows that young adult cancer survivors typically don't have as good of outcomes as other patients do, because we're in the prime of our life, and the last thing we want to do is deal with the diagnosis. And so we do a lot of avoiding, and maybe don't do all the time. I don't know. There's a lot of reasons for that. And I would say I couldn't have conversations with people because I didn't want their story. So in talking to them, it was as if I had to have their story. And I started, but I would hear things like, yeah, it came back in 5 years. And I've had to keep battling. I've been here 20, but you know, it came back 6 times. I didn't want anybody else's story. I wanted my own. And so I didn't want to have those conversations.
So there's some very good literature out there, memoirs, but you know, to read through the memoirs, you have to you hear their stories, and they don't always end well. I mean, I think of two, When Breath Becomes Air, and The Bright Hour, as two very well written memoirs where, I mean, you know from the beginning that the person writing this memoir does not survive the publication of the book. Do you turn to any of those memoirs as sources of wisdom? Do you turn to literature, to poetry? What's your thought about those? So we have Above and Beyond Cancer has a book club, and we sometimes use those books as a source of, let's read these and see what they stir in us. What wisdom can we gain from them? What does it make us think that allows us to gain our own wisdom?
Yeah. I think so that was only in the beginning for me. And then I started the journey of asking and searching and reading, and all of those things became a great source of support for me. I think we go through stages in our diagnosis. And I think that first stage that I was in, or maybe that stage 1, stage 2 that I was in, I just wasn't ready for it yet. I had to process through some things first on my own. So I think being okay with where you're at, but recognizing you can't go it alone. And I did recognize that very quickly. But I think where I was at when I was there was normal. So that would be the thing I would say is, if you're there and you feel like you can't listen to someone else's story, I would say, 1, it's not your story and you will pave your own way. 2, if you still don't feel like you're ready, be okay with that, but keep your mind open to, you'll need support in the journey, because I feel like support is also where we learn how to move forward. And there'll be times when we can't do it, and I need that kick in the pants, or that nudge, or that hug, or whatever it is.
Maybe talk a little bit about when, or if, and if it's so, when solitude is something that you seek. I'm just thinking there are times where, boy, if I'm always engaged in conversation, I can't always hear what I'm saying. And but there are other times where I don't really know what I'm thinking till I hear what I'm saying, and having a conversation can really help me discern and more concretely understand what I'm saying. Do you ever have this push and pull? Sometimes you really want to have this deep conversation for 2 hours that goes by in a blink, and sometimes you want to sit under a tree with your journal.
Yeah. Oh, absolutely. And I learn different things in both spaces. And one of the gifts of this journey has been in learning how to listen to what I need when I need it, and stop listening to the world. You know, the world wants to tell us how we should think and how we should act and what we should do and when we should do it. And nobody knows what I should do better than myself. And so I've really come into this, and part of this was turning 40 a few years ago, and that, just even being there, I'm in my second half of life, and now I get to make the decisions. The world doesn't get to decide for me.
Are there any, so we're getting close to the end of our hour of our conversation, any bits of poetry or wisdom that you turn to from time to time to reinforce a sense of peace and joy?
Music, yes. And you'll put me on the spot. This is where my head, I am terrible at. I have books.
Okay, so for me, you come to my spin class. Tina Turner puts me joy.
Yes.
But that might not be on your joy playlist, but there must be something you can think of this on your joy playlist.
Well, I love Fleetwood Mac.
There we go.
And Fleetwood Mac always, it just brings up all the good things.
Oh, and the Rumors album, looking at
my favorite.
Rumors album.
Yes. Yeah.
Okay.
That's definitely, that would be one that I would pick. So yeah. That and books, I read all the time, and I have tons of books that I've enjoyed, but don't ask me which ones.
And they all have titles I just can't think of right now.
Can I come back to this later and
we
in the comments?
We can.
In the comments
in the comments, and it's poems that speak to us or books that speak to us. Yeah. I think we can do that.
I have a lot. And obviously, I've said many times, my faith. And so for me, the Bible, has been big. And I have a couple devotionals that have been, impactful in my life. So those are, I get up every day and I try to do some kind of a meditation. I have a routine that I feel like if I don't have, that I'm missing something.
Okay. I hope it includes a wee bit of caffeine in your morning routine.
Coffee.
Good. Oh,
Yes.
Good. Excellent.
Yes.
I believe coffee is a very good health food.
Yes.
Yes.
I would agree with that. Yes.
So we'll end it on that. We all want you to have a good cup of strong coffee tomorrow. But thank you, Kim, for being
Thank you for having
here as our guest. And thank you all for joining us. And please do come back next week. If you want to listen to this conversation again, or you would like to share this video podcast with others that couldn't be with us this evening, this recording of this video podcast will be available at the MercyOne website. Or you can go to the Above and Beyond Cancer YouTube channel, and you can listen to this to your heart's content. Please come join us again next week at the Cancer Education Series. This has been Dick Deming and Kim Price.
Thank you.
Thanks a lot.
Thanks.